of the Official Opposition.
Thank you, Madam Speaker. Madam Speaker, this government claims that their out-of-control use of untendered contracts is justified and needed. In December 2023, they signed a $152 million sole source contract in part to create the ARIA Core online medical record system for cancer patients. But not even a year later, among concerns from doctors and staff that ARIA was leading to, quote, near misses, unquote, in delivery of patient care, the system was put on hold indefinitely. This sole source contract was an expensive failure. What was the rationale for not following standard procurement rules?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Speaker. And we continue to invest in our oncology transformation process. We do want a platform that allows not only clinicians but patients across this province to be connected. It's part of the work that's happening not only with Varian but looking at Nuna. We're looking at all of these different platforms. When we hear from clinicians, we do the work initially, of course, in deep collaboration with clinicians. And when we hear that there's an issue, we often will slow down. We put in tickets. We understand how we can improve the platform to make sure that patients and clinicians have a better experience. We'll continue to work with clinicians. We want to make sure Nova Scotians have access to specialized care across this province, and we feel that technology is an important way in order for us to deliver these services.
I recognize the Honourable Leader of the Official Opposition.
Thank you, Madam Speaker. We have a system for evaluating different solutions, and it's called procurement. And the question that we are asking is why this government refuses to use it. Nova Scotians have been clear. They are concerned about how this government spends money behind closed doors, and they want to know how the money is being spent. Doctors have reached out to us, concerned about contracts like ARIA, and concerned that this secretive process is leading to wasted money and fewer results. And yet, even with all of these concerns, Nova Scotia Health still awarded almost $3 billion in alternative procurement last year. Why is this government doubling down on what is clearly a failed approach?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Speaker. So certainly, as we've said before, that alternative procurement or ALT-Ps is often used 10 to 12% of time, actually, in fact. And we use it in health services because often the work that happens or the products that are there are so proprietary, they're so specialized that there isn't a lot of opportunity for us to go out. I'll give you an example. The Varian Ethos 3, we did not procure that. We went through ALT-P. That is one in North America. Why would we go out to a deep procurement process when we know there's only one in North America? And it gave us the opportunity, working with clinicians, working in a value partnership with Varian and Siemens Healthineers, to give first in North America care to Nova Scotians, reducing radiology treatments from 20 to 5.
Order.